Hi everyone, I am Pratima. I welcome you all to this video. So today I'll share about a coping mechanism that is denial, when it helps and when it hurts. Denial is a coping mechanism that gives you time to adjust to distressing situations, but staying in denial can interfere with treatment or your ability to tackle the challenges. Now let us understand what is denial and what is its purpose. Refusing to acknowledge that something is wrong is a way of coping with emotional conflict, stress, painful thoughts, threatening information, and anxiety. You can be in denial about anything that makes you feel vulnerable or threatens your sense of control, such as illness, addiction, eating disorder, personal violence, and financial problems or relationship conflicts. You can be in denial about something happening to you or to someone else. When you are in denial, you won't acknowledge a difficult situation, try not to face the fact or a problems, downplay possible consequence of the issue. Let us see when denial can be helpful. Refusing to face fact might seem unhealthy, but it is helpful sometimes, though a short period of denial can be helpful. Being in denial gives your mind an opportunity to unconsciously absorb the shocking or distressing information at a pace that won't send you into a psychological tailspin. For example, after a traumatic event, you might need several days or weeks to process what's happened and come to grips with the challenges ahead. Imagine what might happen if you find a lump in your throat. You might feel a rush of fear and adrenaline as you imagine it is a cancer. So you ignore the lump, hoping it will go away its own. But when the lump is still there a week later, you consult your doctor. This type of denial is helpful. It responds to stressful information, and you initially deny the distressing problem, but as your mind absorbs that possibility, you begin to approach the problem more rationally and look action by seeking help. Now let us come to when denial can be harmful. But if you had continued to be denial about the lump for a longer time, would it help us? No. If denial persists and prevents you for taking appropriate action, such as consulting a doctor, then it will be a harmful response. Let us consider some examples of unhealthy denial. A college student witnesses a violence shooting but claims not to be affected by it. The partner of an older man in the end stage of life refuses to discuss the health care directives and wills with him, insisting that he is getting better or he will not die. Some ladies deny the domestic abuse and insist that there is no problem with their spouses. A couple are ringing up much of credit card debt that they toss the bills aside because they don't bear to open the bills. The parents of teen with the drug addiction keep giving their child this clothing money, thinking that their child is not taking drugs. A person with chest pain and shortness of breath does not believe those symptoms and signals of a heart attack and delays getting help. In these situations, denial may prevent you or your loved one from getting help, such as medical treatment, counseling, or dealing with problems that can spiral out of control, all with potentially devastating long-term consequences. But it is important to realize that denial should only be a temporary measure. It won't change the reality of the situation. So if you will stuck, or if someone you trust suggests that you are in denial, however, you might try these strategies. Next, some suggested strategies. Honestly examine what you fear. Think about the potential negative consequence of not taking actions. Allow yourself to express your fears and emotions. Try to identify the irrational beliefs about your situations. Journal about your experience. Google it. Open up to a trusted friend or a loved one. Participate in a support group. If you can't make progress dealing with a stressful situation of your own, you are stuck in a denial phase, consider talking to mental health provider, maybe doctor, maybe psychologist, maybe counselor. He or she can help you find healthy ways to cope with the situation rather than trying to pretend it does not exist. In the same way, when a loved one needs help moving beyond the denial, you might find it frustrating when someone you love is denial, having an important issue, for example, such as drinking habit. But before demanding that your loved one face the facts, take a step back. Try to determine if he or she just needs a little time to work through the issue. If your loved one is in denial about a serious health issue such as depression, cancer, or addiction, then broaching the issue might be especially difficult. Listen and offer your support. Don't try to force someone to seek treatment, whether you or your close friend, which could lead him to be angry. Offer to meet together with a doctor or mental health provider. It will help us. So make the denial to be helpful, not the hurtful. Thank you. Thank you for watching. So if you like the video, just share it, subscribe it, so that others can be benefited, and many more of such video we will be waiting for. Thank you. Thank you. Have a nice time.